Gonorrhea is a sexually transmitted infection, or STI. It's caused by a bacterium called Neisseria gonorrhoeae. This bacterium thrives in warm, moist areas of the body. Gonorrhea is very common, with millions of new cases reported each year. This infection spreads easily through sexual contact. This includes vaginal, anal, and oral sex. It can also spread from a pregnant woman to her baby during childbirth. It's important to understand that anyone who is sexually active can get gonorrhea. You don't need to have multiple partners to be at risk. Even if you don't have any symptoms, you can still have gonorrhea and spread it to others. That's why regular testing is so important, especially if you're sexually active. Many people with gonorrhea don't experience any noticeable symptoms. This can make it difficult to know if you have the infection, as it often goes unnoticed. It's important to be aware of the potential signs and symptoms, even if they are not immediately apparent. This is particularly true for women in the early stages of infection. Women may continue with their daily routines, unaware that they are carrying the infection. This lack of symptoms can lead to complications if the infection is not treated promptly. However, when symptoms do appear, they can vary between men and women. Understanding these differences is crucial for early detection and treatment. Both men and women should be vigilant about any changes in their bodies. Men often experience a burning sensation during urination. This discomfort can be quite severe and is one of the more common symptoms that prompt men to seek medical attention. They may also notice a white, yellow, or green discharge from the penis. This discharge can be alarming and is a clear sign that something is wrong. Sometimes, men experience pain or swelling in the testicles. This can be a sign that the infection has spread and requires immediate medical attention. Women may experience a change in their vaginal discharge. This change can be subtle or more pronounced, and it's important to pay attention to any differences. This discharge can be watery, creamy, or slightly bloody. Each type of discharge can indicate different stages or severities of the infection. They might also have pain or burning during urination. This symptom is similar to what men experience and can be quite uncomfortable. Some women experience pain in the lower abdomen or bleeding between periods. These symptoms can be mistaken for other conditions, making it crucial to consider gonorrhea as a potential cause. It's crucial to remember that these symptoms can also be caused by other conditions. Therefore, self-diagnosis is not recommended. Therefore, it's essential to see a doctor for an accurate diagnosis if you experience any of these symptoms. Early detection and treatment are key to preventing complications and spreading the infection to others. While gonorrhea commonly affects the genitals, it can also infect other parts of the body. This includes the rectum, throat, and eyes. Rectal infections can cause anal itching, discharge, and discomfort during bowel movements. Sometimes, there may be bleeding. Gonorrhea in the throat often presents with a sore throat. However, it can also be asymptomatic, meaning there are no noticeable symptoms. Gonorrhea can infect the eyes through contact with infected fluids. This can lead to redness, itching, pain, and discharge from the eye. If you have any reason to suspect a gonorrhea infection in these areas, it's crucial to seek medical attention immediately. Early diagnosis and treatment are essential to prevent complications. Diagnosing gonorrhea is relatively straightforward. Your doctor will ask about your symptoms and sexual history. They will then perform a physical exam. The most common test for gonorrhea is a urine test. This test detects the presence of the bacteria in your urine. Your doctor may also take a swab from the affected area. This could be the cervix, urethra, rectum, or throat. The swab is then analyzed for the presence of the bacteria. It's important to be honest with your doctor about your sexual history and any potential exposures. This information helps them make an accurate diagnosis and recommend the appropriate treatment. Fortunately, gonorrhea is treatable with antibiotics. Your doctor will prescribe the most effective medication based on your specific case and the presence of any antibiotic resistance. The current recommended treatment for gonorrhea is an antibiotic called ceftriaxone. It is usually given as an injection. In some cases, your doctor may also prescribe an oral antibiotic called doxycycline. This is taken for several days. It's crucial to follow your doctor's instructions carefully and complete the entire course of antibiotics, even if you start to feel better before finishing the medication. Section 6. The importance of completing treatment. Preventing resistance and relapse. Completing the full course of antibiotics is crucial for several reasons. It ensures the infection is completely eradicated, preventing it from returning. Antibiotic resistance. Not finishing your antibiotics can contribute to the development of antibiotic-resistant gonorrhea. This means the bacteria become resistant to the medications designed to kill them, making treatment more difficult. Relapse. Stopping antibiotics prematurely can also increase the risk of the infection returning. This is because not all bacteria may have been eliminated, allowing them to multiply and cause a relapse. By following your doctor's instructions and completing your treatment, you play a vital role in protecting yourself and others from the spread of drug-resistant gonorrhea. Section 7. Untreated gonorrhea potential complications. If left untreated, gonorrhea can lead to serious health complications. This sexually transmitted infection, caused by the bacterium Neisseria gonorrhoeae, can silently progress and wreak havoc on various parts of the body. Pelvic inflammatory disease, or PID. In women, untreated gonorrhea can spread to the reproductive organs, causing pelvic inflammatory disease. PID is a severe infection of the female reproductive organs, including the uterus, fallopian tubes, and ovaries. PID can lead to chronic pelvic pain, infertility, and ectopic pregnancy. Chronic pelvic pain can be debilitating, affecting daily activities and overall quality of life. Infertility can be a heartbreaking consequence, making it difficult or impossible for women to conceive. Epididymitis. In men, untreated gonorrhea can cause epididymitis, an inflammation of the epididymis, which is the tube that carries sperm. This condition can result in severe pain and swelling in the testicles. This can lead to pain and, in severe cases, infertility. The inflammation can cause scarring, which may block the passage of sperm, leading to fertility issues. Disseminated gonococcal infection, or DGI. Rarely, gonorrhea can spread to the bloodstream and joints, causing a serious condition called disseminated gonococcal infection. DGI can be life-threatening. Symptoms of DGI include fever, chills, skin sores, and severe joint pain. Seeking prompt medical attention and completing the full course of treatment is essential to avoid these potentially serious health consequences. Early diagnosis and appropriate treatment can prevent the progression of the infection and protect your long-term health. Section 8. Protecting yourself and others. Prevention strategies. Preventing gonorrhea is crucial to maintaining your sexual health and the health of your partners. By taking proactive steps, you can significantly reduce the risk of contracting or spreading this infection. Condom use. The most effective way to prevent gonorrhea is to use condoms correctly every time you have sex. Condoms are readily available and easy to use, making them a convenient option for protection. Condoms act as a barrier preventing the exchange of bodily fluids. This barrier is crucial in stopping the transmission of gonorrhea and other sexually transmitted infections. Regular screening. Regular STI testing is essential, especially if you are sexually active. Testing helps in early detection, which is key to effective treatment and preventing further spread. Knowing your status allows you to receive treatment if necessary and prevent spreading the infection. Early detection through regular screening can make a significant difference in managing your sexual health. Informing partners. If you are diagnosed with gonorrhea, it's important to inform your current and recent sexual partners so they can get tested and treated as well. Open communication is vital in preventing the spread of STIs. Taking these preventive measures demonstrates responsibility towards your own health and the well-being of your sexual partners. By being proactive and informed, you contribute to a healthier community and protect those you care about. Section 9. Open communication, the key to sexual health. Open and honest communication with your partner or partners about sexual health is crucial. This includes discussing STI testing, using protection, and sharing any concerns or potential exposures. Remember, getting tested for STIs is a normal part of taking care of your health. It's a sign of responsibility, not something to be ashamed of. If you have any concerns about STIs or your sexual health, don't hesitate to talk to your doctor. They can provide accurate information, testing, and treatment options. By prioritizing open communication and responsible sexual practices, we can collectively work towards reducing the spread of gonorrhea and other